I'm sure you've heard of prediabetes, but did you know that 1 out of 3 adults has it and that 80% of people don't know they have it? This could include you or somebody you're close to. So that means that many people could be walking around feeling pretty good about their health, not knowing that inside they have an elevated blood sugar that could be starting to cause some health problems because nobody told them about it. If this makes you uneasy, you're not alone. The good news is there's a lot that you can do from a nutrition and lifestyle standpoint to reverse this, which is what I want to talk about today. My name is Martha McKittrick. I'm a registered dietitian and a certified diabetes care and education specialist, and I specialize in metabolic health. I'm very, very passionate about prediabetes and helping you understand it, which is what I'll be talking about today. So today I want to go through prediabetes, what it is, how do you know if you have it, and most importantly, what you can do to reverse it, or at the very least, delay the progression to type 2 diabetes. So exactly what is prediabetes? It's basically a condition where your blood sugar is higher than it should be, but not quite high enough yet to be type 2 diabetes. It could be considered a stepping stone to type 2 diabetes, although not everybody with prediabetes will get diabetes. But the problem is that prediabetes in itself can increase risk for cardiovascular disease and other metabolic issues, so it needs to be taken seriously. So the question is, how do you know if you have it? There aren't really any warning signs or symptoms, so you really need to make sure you get certain blood tests done. The best blood test to help diagnose prediabetes would be something called a hemoglobin A1C. And it's an average of what your blood sugar is for 12 weeks, 24 hours a day. So it's not affected by you having 3 pieces of pizza the night before or a donut for breakfast, because it's an average of 12 weeks. So you want to make sure your doctor is getting that number. And the recommended number would be if it's under 5.7. When you have numbers between 5.7 and 6.4, it's called prediabetes, and when it's 6.5 and higher, it will be called diabetes. So make sure you know what your hemoglobin A1C is. Then another number you could also get tested would be a fasting glucose. You want to make sure that you haven't eaten anything for at least 8 hours, and anything above 100, so if it's between 100 and 124, it could be called prediabetes. Ideally, we want fasting glucose under 100. Now, let's just say you got it done once and it was 105. I wouldn't jump the gun and say you had prediabetes right there. I would want you to get it done again, and I would probably also want you to cross-check it with a hemoglobin A1C, because sometimes I do have clients who have normal fasting glucoses, but their hemoglobin A1C is elevated. So that, again, would diagnose prediabetes. So while the only way to diagnose prediabetes is with the blood work, there are some other warning signs that could suggest some troubles brewing. And this could be if your blood sugar is slowly creeping up as the years go by, not actually in the prediabetes range, but kind of getting up there. If you have an elevated triglyceride linked with a low HDL, that could be suggestive of insulin resistance, which can be a precursor to prediabetes. Also, if you get really, really tired after eating carbohydrates, and if you find that you're gaining weight, especially in the abdominal area, these could be warning signs. So you've been diagnosed with prediabetes. You might be wondering, why did this happen? And this is one of the biggest questions I get asked when clients come to my office, especially if they've been kind of doing all the right thing. They're exercising on a regular basis, they're lean, their diets are pretty good, and they're like, why did I get this prediabetes? You know, sometimes there's just a couple different reasons, and sometimes it's just hard for me to say exactly what it is, but a common one is, especially if you think you're doing everything right, it's just the aging process. And for a couple reasons. One could be, as we get older, we lose muscle mass, and muscle is the main way we dispose of glucose. So when you have a lot of muscle in your body, it's actually pulling the sugar into the cell and getting it out of the blood. So that's helping to lower blood sugar. So when we age, we tend to lose muscle. We don't dispose of glucose as efficiently. Another one could be maybe less exercise. As we get older, we have more injuries. So that in itself blood sugar can kind of go up more. It could also be if you have a family history of type 2 diabetes. As we gain weight, we become less insulin sensitive, because when you have a larger fat cell, it's more difficult to get the glucose from the blood into the cell, because the fat's just making it more difficult to get in. So if you can lose a little weight, which I'll talk about in a minute, that can help you become more insulin sensitive and your blood sugar can go down. For some people, there's more stress, there's less sleep. For some people, it's hormones. And I think the main thing I want to say to you is it's not a personal failure. It's not something you did wrong. It's what's going on in your body, your metabolic health, but there are many things that we can do to reverse this. And last but not least, talking about how to reverse prediabetes. We'll start with diet. Many people automatically assume they can no longer have any sweets, rice, bread, or pasta, and that's not true. But you do want to consume all carbohydrates in moderation because they do cause blood sugar to go up. You also want to have them as part of a balanced meal. So you want to have some protein, some fat, some fiber from like vegetables, and then the carbohydrate. So this type of a meal is going to cause a much slower rise of blood sugar versus if you just had a jumbo bagel or a big bowl of pasta, that will cause a blood sugar spike. You also want to try and choose more unprocessed types of carbohydrates like whole grains or fresh fruit versus juice or processed carbohydrates. And then lastly, when possible, have the carb last at a meal. This isn't a major player, but it could help. So have the salad, maybe the steak, and the veggies first, and then the baked potato last. Moving on to exercise, which is really, really important. All kinds of exercise help. Weight training is especially important because when you have a lot of muscle on you, that's what really sucks the glucose out of the blood and into the cell. Muscle is very active tissue. Aerobic exercise helps too because every time your muscles contract, again, it's getting the glucose from the blood and into the cell. Walking after meals can be especially helpful because that can help to lower blood sugar as well. Moving on to weight. If you are overweight, even losing 5% of your body weight can help with blood sugar regulation. That's because when you have a larger fat cell, it's more difficult to get the sugar from the blood into the cell. But as you shrink that fat cell, you become more insulin sensitive and it gets the glucose into the cell more easy. Don't forget stress management and getting adequate sleep. I've had many clients who've done everything right from an exercise and diet standpoint, but they still have high blood sugar, and it turns out that not enough sleep or too much stress can raise blood sugar. So these are some general tips that I hope help you. Just keep in mind there's a lot that you can do to reverse this, and even if you can't, you can slow the progression to type 2 diabetes. Not everybody gets type 2 diabetes. If you have prediabetes, most people can reverse it, but just know there are many things you can do. I would love to help you. If you need more personalized guidance, just reach out to me and I'll help you.